helping to define what are the research questions that researchers should address. It is critically important to ask patients and have it be patient-centered research. An example that we give is there were some researchers doing research on psoriasis, and psoriasis causes really awful lesions to your skin. And their research was focused on making those lesions smaller. When they finally later asked people with psoriasis what mattered to them, that was not what mattered to them. What mattered to them was where was it located. If it's on your face, then you're socially just unable to participate in the way that you would like. If it's located on your joint, it's much more painful. It's just one concrete example of how if they'd been engaged at the beginning, the researchers would have been informed up front to know critically important research question is the location and how to somehow modify that. So I think, and we're working on this, as some of the people at the table know, we're working on taking a lead in what are the best practices in engaging patients in the research process. How does one identify the right people for that? How does one set up a program, and there's best practices out there, to train individual patients for the core competencies needed for that purpose. So there would be different people, different training, so that they would have a productive and meaningful role throughout the research process. Another point I would make is that we try to emphasize that patients and generally healthy consumers are very different. They're sort of on a continuum. Patients are much more willing to take risks that a fairly healthy consumer would not. And patients as an individual offer incredible expertise and input about their lives, the progression of their disease. Patient organizations become incredibly valuable when the researcher or the entity with whom they're working want to know throughout the course of the disease, over the lifespan of an individual, what is that like and what are the important places along the line. So again, knowing where patients or patient representatives could be valuable is critical to identify those early on in any kind of, whether it's a research process or a healthcare delivery process. So you make sure you have the right people well-trained at the table to help move us along. And one last thought I was thinking about when you said general practitioners. My dad was a wonderful general practitioner, country doctor. And there were very few treatments, a lot of shots of penicillin in your backside. But I will tell you, there's so much more care today. It's so much more complicated. We have to have teams and everyone involved. But there are probably a lot of people who would say, I felt more cared for then, because he knew them as a whole person.